Hi, my name is Amaya.
Hi, my name is Maddie Mears, and we both research nurse practitioners.
So a look at NP in depth.
What really is an NP?
So an RN who has basically gone on to complete either their MSN, which is a master's, or a DNP, which is a doctorate. So they're able to prescribe, diagnose, and interpret medical tests without supervision of a doctor.
And NPs are most often found in a clinical setting or hospitals most commonly. My mom, for example, she actually works in both of these, which is pretty cool with this job. It's very flexible, and where you work and which location is completely up to you. But they can also be found on college campuses, community clinics, and whenever they're needed.
Perfect. So for education, qualification, and skills.
You must, for education, obtain a BSN, pass a licensing exam, obtain an MSN or DNP, and complete clinical research. For qualifications, you must have completion of required clinical hours and pass the NCLEX test. And then skills include leadership, empathy, flexibility, patience, and positivity. So throughout this 100 hours of clinical that we talked about earlier, clinical hours allows the student to practice hands-on skills rather than in classroom work. So examples of clinical work could be working as a CNA, which you've probably commonly heard work in nursing homes and in hospitals. You can also be a live-in where you're with the elder in their home setting and complete hours that way. You can be a medical scribe helping with medications. You can be an emergency medical technician, which is a little bit more advanced, but all of these small jobs starting off really can get you those clinical hours that are required.
Sure. So for a little bit more of the qualification, so when looking at that, so the completion of the clinical hours are so important because they really allow the student to like see what it would be like in an actual hospital setting. And exams and classroom work can only go so far, but really interacting with the patients help them to grasp what their job is. And then for the skills, being patient is so important as well as positive. A hospital setting can be so draining and it's so hard on the patients themselves. And so to have a nurse that's just an MP that's just literally willing to sit with you and speak to you like a person and be positive with their interactions, it can go a long way.
Yep. And then the next slide here, we have some pros and cons. So we'll discuss work schedules, advancement opportunities, a typical salary, and a viable full-time.
Sure. So I would personally categorize an NP's work schedule as a pro, especially if you're in like a clinic setting rather than a hospital setting. So, however, these do include night shifts, which are almost always required, especially starting out. And then holidays, that's definitely a con in that aspect. I mean, you definitely miss out with time with family, etc. So work schedule often varies, especially in a clinic setting.
And then as far as salary goes, typical salary actually ranges quite a bit. It ranges from about 95,000 a year to 150,000 a year. This really depends on your specialty. It's important to note that especially your state that you live in, salaries can be completely different depending on how demanding your specialty might be in that area. For example, if you're in the middle of a large city, maybe it is more demanding where they need more nephrologists or other specialized NPs. It really depends on where you live.
Most definitely. And then for opportunity for advancement, definitely. You can do mentorship, which is basically teaching, and then your specializations definitely help with advancement as well as increase in salary.
And then as far as being viable full time, this job is definitely viable full time. I know from firsthand experience seeing my mom and the way she works full time. And I see that with her going to clinicals throughout the hospital and really switching off. And I really got to see this while shadowing her, is that nurse practitioners can definitely work full time and they do have demanding schedules. So
Perfect. So here are interview highlights.
So FNP Jen Mears provided great insight into what a possible career could look like, as well as what she did to get there. So she really did cover each of our questions in depth, which allowed us an honest look into the medical field. She really helped us understand that all nurses start somewhere, so advancement is possible with hard work. So really with my mom, she had a long road to medicine. She worked in many different clinics. She worked in different specialties. She was even in like radiology before nephrology, and really exploring these specialties and seeing how broad just the medical field is really how she found the passion for her job and her specialty now. So there is so much to explore, especially with nursing. There's so many different routes you can go. And I think she's really been able to show that just with how many places she's tried out and how many states she's worked in. So it's really cool to see.
Yeah, so we also found her determination to receive her degree so fascinating. She explained that her commute was around 3 hours just to literally get to her classes. So right there, you see that her drive is immediately just incredible. And making that drive multiple times a week, also incredible. It was extremely interesting to see how her days varied. She explained that depending on the number of patients, amount of charting, that really made or break her whole entire day. And so that was really cool because we classified that as a pro because Maddie and I both love staying on our toes. We love variety. So we will love that in the medical field.
Yep. And that's part of the reason why we found the question most valuable was, how do you measure success in your position?
Yeah. So measuring success is so important. And she talked about a lot, like measuring the little micro successes, micro victories, as she said, because like I said before, the hospital can just be really draining. And so just see a patient, get better, do better under your care is something super cool. And that not many people can kind of, say that they help.
Totally. And FNP and Mears even explained it being very well by saying, I measure success in patient outcomes and looking at the micro victories. And so with this, even her coming home and telling me how much she helped this elder couple feel comfortable because maybe they had a loved one on the deathbed, or maybe there was a really hard day at work, and just like seeing my mom smile brighten their day. So really it's the job overall is rewarding, but there are so many little things within the job and so many connections you make with people that just don't add up to other parts of the job that you may think that might be great, like the salary, for example. So there really are so many little victories within the job that aren't really given enough credit to.
Right. So the next is our 4 grad schools. So Maddie and I decided to look into UW-Madison, Winona State at Rochester, University of Minnesota, and then University of South Carolina. So we looked into Madison first because of a great location. Madison's a beautiful city. I'm from Wisconsin, so home, grown, I guess. And then my sister also is pursuing her master's right now. So I have some family ties. So that was a big thing of why I wanted to look into it.
Mhm. And then for me, Winona State, I saw was located in Rochester, Minnesota. And we chose this program because it's even closer to home for me. And the DNP program was really interesting to both of us. It seemed very diverse and had lots of options that you couldn't always find at other schools.
Right. And then after that, we looked into the U of M, so located in Minneapolis. Immediately, we knew Minneapolis is a great place. Obviously, at Concordia, we're so close. We can visit the city all the time. It's in a good location. And we were also very interested in the DMP program.
Mhm. And then lastly, we chose the University of South Carolina. It's located in Columbia, and it is one of the top ranked programs in the country, which is very appealing.
Yes.
And then here's a overview of graduate schools.
Yes. So we looked into Madison, like said prior. So they have a 2 to 4 year program. It really differs on your specialty and as well as when you enroll. So it's going to be 68 credits and there are 250 clinical hours. One thing that stood out to us about Madison is 250 is an incredibly low amount of hours, especially compared to Winona, U of M, and South Carolina. And clinical hours can be so draining, but also they're so helpful. So that was something we were a little bit conflicted on, but the hours definitely stood out to us.
For sure. And then Winona State was pretty cool because they offer 3 different nurse practitioner specialties. The credits also range from 72 to 74, depending on the specialty chosen. And this program also had the most clinical hours required, which may seem pretty daunting at first, but it really shows that maybe Winona State is very very important when it comes to like clinical hours and working with patients. They want people to have the most experience as possible, if that makes any sense. So even though it is daunting, this clinical hour number maybe shows a lot of experience from these students. So it's pretty cool.
Yes, most definitely. And then after we looked into the University of Minnesota, so This is a 3-year program, and the website, like, specifically noted 4 days a week attendance. So I don't know if that was strict or maybe relaxed, but they were very, very keen on that is just an asset to their program. Um, for U of M, there are 76 to 80 credits, which also depends on the specialty, and then the clinical hours are around 1,000.
Mhm. And then lastly, the furthest school or University of South Carolina. This program is 4 years long and offers 3 specialties. It's noted that the majority is online, which is pretty cool. Say you're traveling or you prefer online classes, this would definitely be a place for you, and it's very appealing in that way. And they also have a master's program, so the credits and clinical hours are less than other programs, which is a very big pro.
Yes, definitely. So then the next slide, this is going to help with having a deeper understanding for the application process.
Mhm. So the application process for an MSN program or a DNP is quite rigorous and competitive, as you can see.
Yes, so in order to even apply, you have to be an RN, which means you have to pass your NCLEX, which is mentioned in both the graduate with the BSN and pass the NCLEX. So this basically makes you or makes the university or helps them understand that you understand what you learned in nursing school, that you have a comprehension for it, and that you are going to be helpful in their program.
Right. And then after passing this exam, it is required that you submit your RN license number, basically just to confirm that you're actually a nurse and that you've gone through all of this schooling.
Right. And then you also are going to need 3 professional references. So those are basically people, professors, bosses, people that can vouch for your academic as well as your personal success.
Totally. And then you also need to submit an essay. It's important to display your ability to analytically think and express your ideas logically.
And then you also need 1 or more personal or professional nursing experience years. So this basically goes to show that you have a grasp for the nursing field, you understand what goes into it, and then it prevents graduates from applying immediately at post grad because that can be kind of a liability, especially if you don't know what's going on really in a hospital setting.
Right. It's also important to note of deadlines, which are a year prior to attendance of that university. So, for example, UW-Madison's deadline is December 1st, whereas Winona's is October 1st for the fall term. So just make sure to be aware of this and at the deadline for your university of interest.
Right. So we did our compare and contrast for all the universities. So to point out the similarities, it's a 3.0 or higher. You have to pass the NCLEX. All taught the same core 3 specializations, and then professional nursing experience, like said before, is required upon applying.
Right. And then we found some differences, which were that credits range from 47 to 78. Clinical hours range from 250 to 1,080. One program offers an MSN, which is less credits. There are also 2 to 4 year program differences, as well as the University of Minnesota, which offers specialty in women's health and gender, which we did not find at the other universities.
Right. And then, so to summarize, courses are 700 level and above. So extremely challenging, going to be very rigorous and the content's going to be pretty dense. The application process is very rigorous, very competitive. As seen before, you need professional references, you need people to vouch for you. You need to submit an essay. So it's super important. And then there's also heavy clinical hours besides Madison, which 250, if you think about it, is still extremely intense. However, it's going to be far less intense than the others.
Totally. Yep. And then we just want to thank you for watching our presentation. We really enjoyed going through all of this and especially interviewing Jen Mears. This was super insightful, and we are very excited to continue our careers and pursuing medicine.
Yes, most definitely. We are extremely thankful. This taught us a lot, and we were really able to connect with the community of the medical field, especially talking to Miss Mears. So that was amazing. So thank you so much.